Goal setting strategy aimed at increasing adherence to a weight loss in a group fitness setting. Amanda Robinson, student number S0255257, Exercise Psychology, CQU 2015. Implementing a goal-setting strategy aimed at increasing adherence to a weight loss initiative in a group fitness setting. An aerobics class for people aged 45 to 60 years old. Using motivational methods supported by research, I aim to outline strategies to help participants set SMART goals and increase adherence to exercise programs. Goal setting. In order to achieve your goal-specific outcome, you must have a clear goal in mind. Once you have the specific goal, you must formulate a plan of attack to get you there step by step. Creating a plan with a physician or trainer can help a patient outline the steps needed to get there. Formulating a plan of attack can outline the milestones to reach along the way, ensuring plans are in place to make the goal achievable and realistic. SMART goals. Specific. In order to be successful in reaching a goal, you need to have a clear picture in your mind as to what you want to achieve. Measurable. Goals and objectives are measurable when you can quantify them. For example, how much weight do you want to lose? Attainable. A goal is said to be attainable when its accomplishment is within reach. The goals you set for yourself need to be attainable. Realistic. A realistic goal is one that was within a practical range of achievement. You cannot expect to lose 20% of your body weight in 2 weeks, for example. Timely. Goals must have specific timeframes to give urgency to reaching the desired outcome. Determine how long you'll give yourself to reach the goal, either in days, weeks, or months, or a set specific date by which you will reach the goal. Goal mapping shows step-by-step achievements and milestones that need to be reached on the way to the overall goal. Benchmarking. Understand where clients are starting from, what has helped them succeed in the past, and what hasn't worked. You can't measure success unless you have written down specific targets and objects. If a goal is too ambitious at first, break it into manageable steps to achieve along the way. Key performance indicators, or KPI, can help you stay on track and measure your success along the way. These factors must be measurable. For example, aiming to attend 3 fitness classes per week. Know what drives your client. During the health screening process, the trainer or EP talking to the client should focus on management of pre-existing health conditions, taking measurements to benchmark results and assess the starting point of the client to give appropriate direction in a group setting. Working with the client formulating a plan should focus on their intrinsic motivating factors to aid in fitness program adherence. High priority should be given to using the intrinsic motivating values of the client as an individual. Effective physical activity interventions should combine several well-established principles of behaviour change, including social support, self-efficacy, active choices, health contracts, assurances of safety, and positive reinforcement. Autonomous motivation, the reason for their behaviour, are based on intrinsic values. Clients basing their goals on these motivating factors are more likely to perform effectively. Press ETAL 2005. Studies such as group goal setting and group performance in a physical activity context have shown self-efficacy and physical activity levels influence the magnitude of the group goal and group performance relationship. Burke ETAL 2010. When goals are set in group activity by participants, greater adherence to the goal has been observed. Participants have been shown to be more likely to do their part in challenge situations and show greater attendance to physical activity programs when supported by peers. Tailor the session to the fitness level and enjoyment of the client. Make goals achievable by starting low-impact activities and increasing difficulty and intensity as your client's skill level and fitness increases. Increase adherence by starting small and making tasks achievable, while outlining the benefits of exercise to support the client's intrinsic motivation. For example, feeling good after exercising, reducing the risk of disease, and aesthetics. Start with mobility, flexibility, increasing conditioning, and encourage social interaction with games. Encourage clients to plan ahead and prepare for exercise to make it part of a routine. Start at a manageable rate of exertion and keep it simple. The peer support element of physical activity programs such as specific aerobics classes, 60 and better programs, and light and easy classes give participants a social element to attend and meet other people in a similar age bracket. These classes can combine a range of abilities and skill levels and can be an encouraging place to start. Members are encouraged to start and work at their own pace and gradually build in intensity and duration for progression and overload to occur. Creating progression and overload to challenge clients to improve. As with any exercise program, progression and overload principles must be explored as the skill level of the group increases. As this skill level increases, it is important to reassess the group goals and also the individual's goals to assess the progression and ensure the achievements of the group are measurable against the prescribed time frame. The success of goal setting depends upon taking account of the mediators and moderators that determine its efficacy and applicability. Block and Latham, 2006. The FIT principle increases overload. As a whole group, further set goals to increase the group adherence. FIT principle. Using the FIT principle to increase overload and progression, set further goals as a whole group to increase the group adherence. Brainstorming goals to pursue a common goal, not one preset by someone else. F. Frequency. I. Intensity. T. Time. And T. Type. Frequency. How often you exercise. Take into account recommended guidelines for physical activity, pre-existing medical conditions, and remember to start off a program with a simple approach and build as fitness increases. Intensity. How hard you work during exercise. Use fitness testing benchmarks to set intensity and retest to show progression when increasing the intensity. Time. The duration of your exercise session. From the fitness screening results, shorter session times or longer rest periods may be needed when starting out. Build session duration as fitness and adherence increases. Type. The type of activity you are doing. When starting an older adults fitness program, incorporate elements of balance, flexibility, strength, and endurance. Use the other aspects of the FIT principle to vary the intensity of the program and add variety. In summary, to increase adherence to an exercise program for older adults aged 45 to 60 in a class setting. Know your client. Use health screening and fitness testing for benchmarks to be assessed and reassessed. Set goals. Use your client's intrinsic motivation to find goals and solutions attractive to them. Smart goal setting. Break up the overall goal into manageable tasks for the client to see progression and aid in adherence. Make exercise enjoyable. Use exercise as a chance for social interaction, support, and team building. Use exercise as an opportunity for positive self-talk and self-efficacy instead of an inconvenience. Use self-efficacy and group goals as motivation for adherence. Use the FIT principle to create overload and challenge your clients while adding variety to each session. Remember to keep it simple. The first steps in a new fitness routine are often the hardest, and it is important for participants to start out at their own pace to avoid injury and burnout. Last of all, make it fun. Make fitness sessions enjoyable, time to look forward to, engage the group to set team goals, and make them achievable.